Before we begin, I have a leave request for this section of the Committee of Supply. Is there leave to allow the opposition to sit on the other side of the table to allow them to see the screens that are situated in the room? Leave has been granted, and that's what we shall do. This section of the Committee of Supply will now consider the estimates of the Department of Seniors and Long-Term Care. Does the Honorable Minister have an opening statement?
Yes, I do, and thank you, Mr. Chair.
The Honorable Minister, you may proceed with your statement.
Thank you. On behalf of the Department of Seniors and Long-Term Care, I am very pleased to present the financial estimates for the 2022-23 fiscal year. The Department of Seniors and Long-Term Care was established in January 2022 to provide stewardship over the implementation of the Stevenson Review recommendations, as well as the implementation of a new senior strategy so that aging Manitobans are able to
Excuse me, Minister. Would it be possible for you to get a headset, because the Hansard staff is having a difficult time hearing you, and we are in the room here as well?
I can do that, Mr. Chairman, if you just give me a moment.
Okay. The Honorable Minister of Seniors and Long-Term Care, are you ready to go again?
Can you hear me, Mr. Chair?
Much better.
Thank
The Honorable
you.
Minister for Seniors and Long-Term Care.
Thank you, Mr. Chairman. I'm not sure exactly where I left off, so please bear with me. The Department of Seniors and Long-Term Care was established in January 2022 to provide stewardship over the implementation of the Stevenson Review recommendations, as well as the implementation of a new senior strategy so that aging Manitobans are able to stay in their own homes and communities as long as it is safe to do so. The COVID-19 pandemic exposed gaps in our long-term care system here in Manitoba and across Canada, and drew our focus to seniors who were not receiving the dignified care that they deserve. These gaps are reflected in the external government commissioned review led by Dr. Lynn Stevenson. The review resulted in 17 recommendations at the facility level as well as the systems level, including but not limited to ensuring that staffing levels and services provided are appropriate to the complexity of current and future residents, and reviewing and streamlining the license standards for personal care homes to ensure currency and applicability to the changing needs of residents. The proposed 2022-23 core budget for seniors and long-term care reflects an expenditure of $54.3 million and 14 staff years, FTEs. The summary budget is set at $54.4 million. This year's budget includes investments in the following: $32 million for the implementation of the recommendations of the Stevenson Review, such as following key areas already announced: enhancement of infection prevention and control within long-term care sector, additional full-time equivalent housekeeping staff, improvements in emergency, continual and situational aware with personal care homes through enhanced internet connections to patient and operational information and communication technology. Our government also is reviewing the recommendations of a work group charged with the development of staffing recommendations for increased staffing at bedside. 20 million to support the implementation of early actions on a new senior strategy. After an extensive engagement and consultation process with Manitobans to provide advice for design and action plan of the senior strategy and to recommend priority investments, 1 million for salaries and benefits for new staff and other consultations, project and other operating increases. I'd like to take this opportunity to thank you very much for the opportunity to say a few words on this year's estimates. I would also like to acknowledge my colleagues in other departments such as health for their partnership and support in this important work for Manitobans. I would now be happy to answer any questions that you may have. I would at this time like to introduce my staff, Mr. Chairman. I have with me Bernadette Proyne, my Deputy Minister of Seniors and Long-Term Care, Sandra Henault, Assistant Deputy Minister and Executive Financial Officer, Manitoba Health, Mental Health and Community Wellness and Seniors Long-Term, and Laura Morrison, Executive Director, Seniors and Long-Term Care. Thank you, Mr. Chairman.
We thank the minister for those comments. Does the critic from the official opposition have an opening statement? The member for Union Station.
Thank you, Mr. Chair. I'm pleased to put a few words on the record for estimates of the Department of Seniors and Long-Term Care. As Manitobans know, we've been very concerned about this particular area of government. The pandemic exposed the gaps in the system of care for many of the most vulnerable people in our province. And while we've seen the impacts of these gaps across the country, certainly here in Manitoba, unfortunately, we saw a disproportionate number of heartbreaking outcomes for seniors in our province and their families. I have several questions in this area, including the number of beds that are currently available, when standards for personal care homes may change, how much of the federal funds allocated for this area in Manitoba have been spent, and how much additional staff has been added to personal care homes in Manitoba. And this is one area certainly everyone, I think, across the province is acutely aware needs to be addressed. I'm hopeful that this will be a productive session, and it will be a session that advances the concerns of seniors, their families, and communities. Thank you. And with me today, I'm joined by Hannah, our staff, one of our staff in our caucus, Hannah Drudge.
Under Manitoba practice, debate on the minister's salary is the last item considered for a department in the Committee of Supply. Accordingly, we shall now defer consideration of line item 34.1 brackets A contained in Resolution 34.1. According to our Rule 78 bracket 16, during the consideration of departmental estimates, questioning for each department shall proceed in a global manner, with questions put separately on all resolutions once the official opposition critic indicates that questioning has concluded. The floor is now open for questions. The member for Union Station.
Thank you, Mr. Chair. I'd like to start by asking if the minister can tell us the names of all of his political staff.
Minister, whenever you're ready, if you could please raise your arm so I can acknowledge you so that Hansard can turn you on. The Honorable Minister of Seniors and Long-Term Care.
Thank you, Mr. Chair, and I assure you after we work out these kinks, we'll start rolling very smoothly. My apologies. My political staff are Larissa Gobert, as well as Danielle Orvis.
The member for Union Station.
I thank the minister for that information. Can the minister advise us how many vacancies are there currently in the minister's department, and what is the vacancy rate?
The Honorable Minister of Seniors and Long-Term Care.
Thank you, Mr. Chairman. At this time, there are no vacancies and no vacancy rates.
The member for Union Station.
I thank the minister for that response and that information. And I think that's a good thing that there's no vacancies in the department. We see the challenges that's been creating in other departments. On page 24 of the estimates book, it shows that there are 6 staff plus the minister assigned to executive and 7 staff that work in the Department of Seniors and Long-Term Care. That's 50% of this area of government assigned to the executive, or rather to executive staff. Can the minister explain that for us?
The Honorable Minister of Seniors and Long-Term Care.
Thank you, Mr. Chair. In answer to the question, there is myself as the executive. I have 2 political staff, 2 office assistants, 1 deputy, and 1 deputy assistant, we were resourced with policy units to support the Stevenson review, as well as the ongoing senior strategy. Otherwise, we are supported through the Department of Health resources.
The member for Union Station.
I thank the Minister for that response. I noticed on page 25, under equity, page 25 of the supplement to estimates of expenditure, under the equity and diversity benchmarks, that there are a number of equity-seeking groups identified: women, Indigenous peoples, visible minorities, which I don't love the language of, but that's what's being used, and persons with disabilities. But there is an absence of 2S, so Two-Spirit, LGBTQ folks, and gender diverse people. So I'm wondering, given that it's here, there are benchmarks that are identified in terms of having that represented within the department, but there's a notable absence of an equity-seeking group that is significant. I'm wondering if the minister can provide some clarity as to whether or not, in fact, that information is being requested of folks and is a part of this equity and diversity benchmark strategy. Was it an oversight, or in fact, is that information not being gathered, and are Two-Spirit and LGBTQ IA folks and gender diverse peoples not going to be reflected in the equity and diversity benchmarks?
The Honorable Minister of Seniors and Long-Term Care.
Thank you, Mr. Chairman, and I thank the member for the question. I would like to thank the member for bringing to our attention the ambiguity in the documentation that she references. I have taken note of that. In regards to her question, when there is
If I could
recruitment going,
interrupt the minister for a second to address the critic with the proper gender? Pronoun. They The member for Union Station.
Oh, my apologies, no disrespect intended. Thank the member from Union Station for the question and bring forward the issue of documentation that we've made note of. As well, an answer to the member from Union Station's question. Under recruitment, we would have asked to identify if they wish.
The member for Union Station. Rick, to move over.
Can the minister clarify then, will gender diverse and two-spirited LGBTQIA employees be represented by way of data in the equity and diversity benchmarks? Obviously, I encourage the minister to ensure that in terms of documentation that this is corrected moving forward, but can he clarify whether or not his response means that they will in fact be reflected in the benchmarks?
The Honorable Minister for Seniors and Long-Term Care.
Thank you, Mr. Chair. The short answer is yes.
The member for Union Station.
I thank the minister for his short answer. I appreciate it. And again, I hope that, these folks are represented moving forward in documentation. A lot of folks who perhaps look at this data, this information that the government is purporting to be collecting, deserve to see themselves and their identities reflected in the efforts the government says it's making. Next question is on page 31 of the estimates book. It says that, and I quote, "No statutes have been assigned to the minister," end quote. So if the minister has no legal responsibilities by way of statutes, can the minister then provide an overview of what his responsibilities are? Thank you.
The Honorable Minister of Seniors and Long-Term Care.
Thank you, Mr. Chairman, and I just wanted to just reiterate the mandates and responsibilities that were given to this department by the Premier, which were focused in really two major areas. First, as I had indicated in my earlier comments, the Stevenson review, which was initiated by the Premier when she was Minister of Health, and when she became Premier was quite adamant that these particular needs of seniors are to be met by establishing our department. And so the Stevenson review basically committed the Manitoba government to over $31 million in funding to support the implementation of 17 recommendations. And of that 31, over $15 million in initial funding will support the enhancing of infection prevention and control, including 50 infection control staff, more than 200 full-time housekeeping staff, 44 allied health staffing, and I know that certainly the member from Union Station is very supportive of allied staff. I remember her making a statement in the
I must
legislature.
interrupt the minister again and remind him when referring to the MLA for Union Station, members should use the pronouns they or them. And I thank you for your respectful cooperation. The Minister for Seniors and Long-Term Care.
Thank you, Mr. Chairman. Again, certainly no offense intended. And I hope to be able to not make those mistakes when referring MLA Union Station. Again, back to what the Stevenson review really was laid out as far as my mandate goes. Certainly was to enhance infection protection and control, including 50 infection control staff, more than 200 full-time housekeeping staff, and 44 allied health staffing. Improvements to information and communication technology to better support operations and patient care. Also, a further $16 million in addition to funding to expand staffing and training in personal care homes, including nurses, allied health, and recruitment and training incentives. System improvements already underway is stabilizing staffing complements in personal care homes, increases for nurses, healthcare aides, allied health, infection prevention, and control staff and housing. Long-term care leadership structuring to provide consistent medical guidance and communications to address cross-system issues, and advancing health resource planning to address infection control and address staffing challenges. Now, some of those comments are redundant, but they all certainly have different components to them with different initiatives. Madam Chairman, or Mr. Chairman, also too, certainly a large component of this department's responsibility is to develop a senior strategy. And I have indicated that on numerous occasions in the House when I had indicated how this department is progressing to try to fulfill the needs of seniors and what initiatives that we're looking to proceed with. We have initiated certainly public consultations through community engagement networking, and those are going on as we speak. And we are approaching certainly stakeholders as well as seniors in all parts of the province to come to terms with understanding exactly what those needs are and what those particular individuals are advocating for. And we see that as being extremely positive and certainly something that will ultimately develop what our long-term strategy is.
The
There
minister's
are-
time has expired. The member for Union Station.
I thank the minister for that response. According to public accounts, this is a direct quote, actual expenses for seniors and long-term care were less than $500,000. For display purposes, this is shown as zero, end quote. That's on page 48 of public accounts. Can the minister explain why the actual expenses for his department were $0 last year?
The Honorable Minister of Seniors and Long-Term Care.
Thank you, Mr. Chairman, and thank the member from Union Station for the question. This department came into effect January the 18th. The end of the fiscal year was March 31st, according to public accounts. So the expenditure within the department at that time, as we were getting set up, was frankly very minimal. Any expenditure we did have was relating to staffing, and that staffing was really myself and my deputy. So that I think addresses that question, is that our expenses were minimal because of the early development of the department during that financial time frame.
The member for Union Station.
I thank the minister for that response. Manitoba has a federal provincial agreement right now with the federal government. It's called the Safe Long-Term Care Agreement. It's 100% federally funded, 100% federal dollars. The agreement says that Manitoba was to receive 37 million dollars last year. Can the minister tell us how much of that money was actually received in 2021-22, and how much was spent, and how much will carry forward to future years? So I'll repeat that just to make sure that I'm perfectly clear. Of the $37 million that Manitoba was to receive last year, can the minister tell us how much of that was actually received, how much was spent, and how much will carry forward to future years?
The Honorable Minister of Seniors and Long-Term Care.
Thank you, Mr. Chairman. In answer to the member of Union Station's question, $37 million was received by the Manitoba government. $37 million was spent primarily in personal care homes. And in answer to the question of what's carried over, the answer is none.
The member for Union Station.
I thank the minister for that response. Can the minister provide a breakdown of how the $37 million was spent? So where specifically, what initiatives the money funded, what positions, et cetera. So would really appreciate if the minister could provide clarity and articulate just how that $37 million was spent.
The Honorable Minister of Seniors and Long-Term Care.
Thank you, Mr. Chair. In answer to the member's question, funding received from the federal government for expenses incurred in the following areas were the operation and maintenance of internal and external visitation shelters to provide a low-risk environment for in-person visits with residents. Secondly, strengthened infection prevention and control measures, including enhanced screening protocols for staff and significantly increased cleaning and janitorial services. And last, the implementation of a one-site staffing model across long-term care homes, including incremental staffing costs incurred because of additional staff and sick time.
The member for Union Station.
Can the minister provide me with a breakdown of how much money was spent on each of these initiatives? Of particular interest are the visitation shelters. Those shelters were established well before the minister became the minister of this new department. Those shelters were long completed. And so I'm just wanting some clarity here as to why those shelters would then be part of the new dollars received from the federal government. It's not a criticism, it's just a curiosity, and I'm seeking clarity. So while I appreciate the minister providing a breakdown of the initiatives that the money was spent on, it would be great, and it's important actually that the minister can also provide a breakdown of the associated costs with those initiatives. Thank you.
The Honorable Minister of Seniors and Long-Term Care.
Thank you, Mr. Chairman. In answer to the member's question, Safe Long-Term Fund applied to expenditures incurred approximately 18 months prior to the end of the fiscal year 21-22. The actual values for the initiatives are still being finalized. We expect that we'll have the finalized expenditures at the end of this calendar year.
The member for Union Station.
I apologize. Can the minister repeat that answer? I didn't catch all of it.
The Honorable Minister of Seniors and Long-Term Care.
Yeah, happy to. Safe Long-Term Care Fund applied to expenditures incurred approximately 18 months prior to the end of the fiscal 21-22 year. The actual values for initiatives are still being finalized, and we expect they will be finalized by the end of this calendar year.
The member for Union Station.
I thank the minister for his response and for providing clarity. I do look forward to seeing the breakdown of expenditures. I think that Manitobans would be very interested in seeing that as well. Understanding now that the funds could be applied to expenditures incurred 18 months prior to the end of the fiscal year does raise questions for me around those funds being put to good use in terms of new initiatives to address concerns in this particular area, especially given that this is a new department and the opportunity that exists there to do so. So we'll await that information, I guess, by year end. I'd like to ask a question still on this area of funding from the government. I'm wondering if the agreement with the federal government has been renewed. The current agreement is on the government's website, and it states that it's for 1 year. So can the minister provide clarity as to whether or not the agreement has been renewed beyond that? Thank you.
The Honorable Minister of Seniors and Long-Term Care.
Thank you, Mr. Chairman. I would ask if the member could give us some clarification on which agreement she's referring to. We want to make sure that we give her the most accurate information.
I must remind the member again to, when referring to the MLA for Union Station, members should use the pronouns they or them. I thank you for your cooperation. The Honorable Minister of Seniors and Long-Term Care.
Sorry, Mr. Chairman, and apologies to the member from Union Station. Yeah, just for clarification, if the member could give us what particular agreement the member's referring to, then we want to make sure that we give the most accurate information to the question being asked.
The member for Union Station.
Thank you for asking for that clarity. I actually misspoke on my question, which is probably why the minister is having a tough time finding the answer. I just want to remind the minister, I do use gender-neutral pronouns. I've been a member of this House, of this Assembly since 2019. My pronouns have consistently been gender-neutral since before then, but certainly to his knowledge since then. So I would greatly appreciate that he get it right. I don't really need any further apologies. I do need the minister to respect my pronouns and use them correctly This is not just about me, it's also about many other people who also use neutral pronouns or pronouns perhaps the minister is not accustomed to, but he should be. So get it right, please. Thank you. So to correct myself, because I did ask in reference to the wrong agreement, I apologize for that. The Canada Manitoba Home and Community Care and Mental Health and Addiction Services Funding Agreement. That is a mouthful, but that is the agreement that I was actually referring to, I meant to refer to. So I'll repeat that for the minister. Canada Manitoba Home and Community Care and Mental Health and Addiction Services Funding Agreement. Can the minister clarify if that agreement with the federal government has been renewed? That is the agreement that is on the government's website that stated it was for up to 1 year. Thank you.
The Honourable Minister.
Thank you, Mr. Chairman. I would ask that the member would be properly suited channeling that question to the Minister of Health and Community Wellness during that estimate process. I think that's where the question would be better suited.
The Honourable Member for Union Station.
I thank the minister for that direction. Outside of executive, the minister's department is basically 7 positions. We've already touched on that earlier in my questioning. Those 7 positions are administering 2 big pots of dollars in 2 particular streams. One is $32 million in grants, and the second is $21 million in other expenditures. Can the minister take us through those blocks of funding? If possible, provide as much as a thorough breakdown as possible in terms of what those streams of dollars are allocated to specifically. Thank you.
The Honorable Minister.
Thank you, Mr. Chairman. In answer to the member's question, 19.9 million that was referred to was for the seniors strategy. As I had mentioned in the legislature a number of times, our department is bringing forward early actions that we have identified based on our consultations, and look forward to sharing those with the legislature and ultimately the Manitoba public soon. The 32 million that was referred to was invested with the Stevenson report recommendations, and I did go through those earlier in our deliberations. However, the major expenditure of that is the two announcements that we had made of $15 million, as well as a second announcement of $16 million, as I mentioned, the announcements that have been made. If the member has further questions, I'm happy to try to give more detail.
The member for Union Station.
I thank the minister for that response. I may go back specifically around the $16 million, but I'll leave that for now and I'll go over that in my mind a little bit more. I'll move on to a question around consultation, or the consultant rather. So I understand that there is a consultant, or maybe the government uses the language of contractor for the senior strategy. Can the minister tell us who that consultant is, what their budget is, and how much they have been paid?
The Honorable Minister of Seniors and Long-Term Care.
Thank you, Mr. Chair, and sorry for the delay in getting back to you here. The consultants that we had contracted were Optimus SBR, and the amount that they were contracted for was, or budgeted for, was $475,000.
The member for Union Station.
Thanks. Thank you. I thank the minister for that response. Can the minister provide some clarity around, so the contract was for $475,000. Can the minister clarify if that $475,000 has been paid in full? And if not, then how much has Optimus been paid? And is the minister able to provide a breakdown on what that $475,000 entails? So perhaps a percentage around if part of that $475,000 covers consultations, perhaps another percentage out of that $475,000 is for some other aspect of that contract. As much detail as possible would be great. And then again, some clarity around how much have they been paid, or has it already been paid in full? Thank you.
The Honorable Minister of Seniors and Long-Term Care.
Thank you, Mr. Chairman. I would like to clarify something. I misspoke. I said $475,000 contract. I should have said, or for the record, it should be 475,000 budget. So I wanted to clarify that. In answer to the member's question, nothing has been paid to date. And the components of the agreement include research, engagement and consultations, data analysis, and strategy and action plan development. Those are the 4 areas that we have engaged them on.
The member for Union Station.
I thank the minister for providing that information and for clarifying what he meant when he provided the number. Over the summer, the minister extended consultation for the senior strategy. I appreciate that the minister provided the $475,000 number. I'm wondering if the minister can clarify if the extension of the consultation impacted the budget. He's already said that nothing has been paid as of yet, but is the $475,000 budget, has that always been the budget, or did the extension of the consultation increase the budget? If that is the case, what was the original budget attached to this contract? Thank you.
The Honorable Minister of Seniors and Long-Term Care.
Thank you, Mr. Chairman, and to address the questions that the member had asked. Work has been done on the consultations. However, we have not been invoiced as of yet for that work. Consultations were always designed to be comprehensive with the consultant supporting my department. And there was nothing changed in the budget to accommodate this arrangement agreement.
The member for Union Station.
I thank the minister for that response and for providing clarity around that process. I appreciate it. I'd like to ask a bit about the seniors advocate. The minister has heard me and members of our NDP caucus advocate for this now for quite some time, certainly since 2019. And what I found interesting, the first time I raised this with the minister in the House, the minister essentially outright rejected it as a potential measure that this government might take. And it is something that Manitobans have been calling for some time. Seniors have been calling for some time. So I'm wondering if the minister can provide a bit of, help me understand, why he rejected this idea, something that seniors are calling for, advocacy groups are calling for, when consultations are underway. To me, it doesn't quite line up. Like, why undergo all of these consultations if the minister's mind has already been made on these really significant areas and issues? So just wondering if the minister can provide some clarity around why the consultations, if his mind is already made up in areas like the idea around the establishment of a seniors advocate.
The Honorable Minister of Seniors and Long-Term Care.
Well, thank you, Mr. Chair, and certainly I know how passionate the member is on this particular issue. I want the member to know that there has been discussions in regards to this consideration. However, it was the feeling of our government that by creating this ministry, that a seniors advocate wasn't warranted when you have the authority that now exists for seniors at the cabinet table. There have been certainly a number of initiatives that have been taken, that have been brought forward so far by our department that are a direct result of having a department with a minister. I don't think a seniors advocate would have been able to initiate the Stevenson review at $32 million. I don't think that a seniors advocate would have been able to initiate the senior strategy at $20 million. I mean, our whole seniors department budget is over $50 million. So those dollars certainly are being spent by this department very aggressively to fulfill the needs of seniors. And that will continue. As I'd indicated to the member on several occasions, we have a number of initiatives that are coming forward as early initiatives based on the senior strategy, as well as the overall senior strategy with a number of initiatives that we will be looking to initiate longer term for the good seniors of Manitoba. All that's happening because of the aggressiveness of a department with a minister. So I'm not fully understanding why the opposition feels that a seniors advocate would have more authority or more of a lobbying power than the minister himself or herself or themselves to be able to accomplish results. Now, I want to ensure that I want to indicate to the member that we have talked to an awful lot of stakeholders. And I don't necessarily agree with the member that all stakeholders are advocating for a seniors advocate. I don't believe that's accurate. I will say that there has been some stakeholders who have brought the issue to my attention, but I can assure you that hasn't been the majority. And I'm just not comfortable at this time creating a separate department of government to address really what our department is addressing right now. And we are going to the public of Manitoba through consultations. We have invited a number of stakeholders to contribute and give us input into what the needs of seniors are. So, and I will say to the member that as the consultations continue, I am not closed-minded to further development of the department to address and fulfill concerns that may exist in home care, which is certainly on our radar. And I'm not necessarily opposed to looking to enhance the department to address personal care home needs. Those are things that I am open-minded to when it comes to the consultations that the member refers to. So I'm not at this time prepared to make a commitment, but I am open-minded to some further support mechanisms. So I hope that answers the member's question.
The member for Union Station.
I thank the minister for his response and for sharing some feedback in terms of what he's hearing from folks in consultations. I'm not surprised to hear that there are folks who are raising the issue of the creation of a seniors advocate, and that folks are still raising that as something they'd like to see. To be clear, a seniors advocate would not be a department, as the minister referenced. I think the minister, if the minister were to look at the children and youth advocate as an example of an entity that exists as an independent body to advocate on behalf of children and youth in our province, and the importance of that entity functioning as an independent body that ensures and fights for the rights of children and youth. Children and youth are a vulnerable demographic in many ways, and it is critical that this entity exists in order to advocate alongside them and their families and on their behalf. And similarly, certainly I'm not comparing seniors and elders to children and youth, but I am identifying that seniors and elders live sometimes with vulnerabilities within our systems that require increased supports and advocacy and investigation. And so I think that it is important, certainly while I respect the minister in his role and respect his knowledge and experience in being in that role, I would certainly caution the minister, as I would any minister who would purport to know what is in the best interest definitively and not be open to an independent perspective which would support his department and support his role as the minister. I think that is, again, I'll reference the Children and Youth Advocate as a very good example of an entity that provides vital, critical, quite frankly, life-saving information to the government in regards to measures that can be taken, strategies that can be undertaken, and data that informs the ways in which we can better support and enhance the rights of children and youth. Certainly, I would think that the minister would recognize the importance of that entity And when you connect that to why folks are perhaps advocating for a seniors advocate, I hope the minister can see the potential value in that. So I just wanted to make sure I put a few comments on the record to clarify that no one's calling for a new department, but are calling for an independent body which would actually function to really support seniors and elders in Manitoba, and also to support the government in being able to make the best decisions for those folks. I'd like to move on to a question and go back to the minister's actual House book. So tab 4, rather, of the minister's House book talks about the number of personal care home beds in Manitoba. From March 31st of 2016, there were 9,698 personal care home beds in Manitoba. In March 31st of 2022, we see 9,505. That's a loss of personal care home beds. Can the minister tell me how many personal care home beds are currently available in Manitoba and or occupied in Manitoba?
The Honorable Minister of Seniors and Long-Term Care.
Thank you, Mr. Chairman. I was wanting the member to clarify which document that she is referring to, or that
I must,
referring to, sorry.
the Honorable Minister of Seniors and Long-Term Care.
Member from Union Station, please clarify which document that is being referred to.
The member for Union Station.
My apologies to the minister. I can't provide clarity on that point, and I do apologize for that. Is the minister able, in the absence of being able to provide that, the minister should be able, however, to provide the information around how many beds are currently, rather how many personal care home beds are currently available and or occupied in Manitoba? That would be a number that should be readily available. So while I apologize, I can't provide the clarity he's seeking specifically. The information that I am in need of should be available to the minister. Thank you.
The Honorable Minister of Seniors and Long-Term Care.
Thank you, Mr. Chair. We would want to verify this number with health, but it's our initial data that indicates 9,513 beds are available. But again, I want to give the member the most accurate information that I can. So I do wish to verify that with the Department of Health. And secondly, in regards to the amount of beds in use, again, I don't want to give the member an inaccurate number, so I would get back to her with verification of that number also. Or get back to verification to the member with that number.
The member for Union Station.
I thank the minister for providing that information, and I appreciate him taking the further provision of data as an undertaking. Thank you.
The hour being 5 p.m., committee rise.